The aim of this video is to show the practitioner how to perform a PICC line removal. The practitioner should make an assessment of the appropriateness of the intervention, the wellness of the patient, any potential contraindications showing on screen now, and the patient's nursing, medical and line care pathway notes should be reviewed. Preparing the environment, you should ensure you've got space, light, treatment trolley, nurse call button, hand washing facilities, personal protective equipment and cleaning wipes. Preparing the equipment using aseptic non-touch technique practice and washing hands as per hand washing policy. Introduce yourself to the patient and gain verbal consent. Preparing the patient is crucial. Do they have any concerns or questions? Have they got any allergies? Maintaining their privacy and dignity whilst achieving a comfortable position with the use of a pillow if necessary. Checking their ID bracelet or 3-point verbal ID. Clean the trolley with a Clinell wipe and then apply apron and gloves. Clean 2 blue trays with a Clinell wipe or suitable alternatives in the community setting. Prepare all the equipment using aseptic non-touch technique. The equipment you need for this procedure is 1 sterile dressing pack, 1 Clinell skin wipe, one sterile occlusive protective dressing, one pack of sterile gauze, one ChloraPrep vial, one ampule of sterile water, a sterile drape if available, 2 blood culture bottles if required, 1 sterile sample pot, 1 pair of sterile scissors. You may see different types of PICC lines in the trust. Placing the clinical laminate sheet under the patient's arm, the top dressing should be removed in an upwards motion from the line and hub up the arm to avoid any uncontrolled dislodgement of the line. Removing the securement device with an alcohol agent whilst controlling the line position to prevent any movement or introduction of bacteremias. Taking the Clinell skin wipe and using the whole of the wipe, clean the skin for at least 30 seconds, especially around the insertion site. This should be allowed to dry for 30 seconds. Whilst the arm is drying, remove your gloves, discard, gel your hands and put on the sterile gloves. Take the sterile gauze or the sterile drape if available and place between the patient's arm and the line. Ask the patient to take a deep breath, holding their breath and bearing down. This creates positive pressure in the chest and minimises the risk of air embolus. Holding the hub of the PICC line, pull slowly back on the line, withdrawing about 5 cm at a time, all the time speaking to the patient, asking if they are okay and not experiencing any pain or discomfort. Continue withdrawing the line 5 cm at a time until it has all been removed. Immediately place the sterile gauze over the insertion site and apply firm pressure. This should be for a minimum of 3 minutes or until the bleeding has stopped. Apply the sterile occlusive dressing and advise to keep in place for 24 hours. Check the length of line removed against the documented inserted line length. shown in 1 cm increments. If the line has been removed due to infection, then the tip of the line holds vital information. Using sterile scissors, cut approximately 5 cm from the tip into a sterile container for microbiological investigation, alongside the blood cultures and insertion site MRSA swab. Dispose of all waste, remove gloves and aprons and wash hands, and then complete any paperwork necessary, including the trust line care pathway.